Hi there. This is Dr. Israr Khankhel. I am the board certified obesity and family medicine specialist. Today, I want to talk about a very, very important topic that is very dear to my heart. And the reason is that this disease is basically the pandemic of this century. And what is that disease? That disease is fatty liver disease. Now, what is fatty liver disease? Basically, the fatty liver disease could be due to a variety of reasons. It could be due to the medication side effects. It could be due to the alcohol use. It could be due to metabolic disorders. But what we want to talk about is we want to talk about the NAFLD, non-alcohol fatty liver disease. That is our topic today, which is to say that somebody who is not drinking, does not have any significant medications history that he's taking, he does not have any metabolic diseases, all those things are ruled out. And now we consider this fatty liver disease as non-alcohol fatty liver disease. Okay, good. So why it is so important that we need to talk about it and we need to know about it? Well, the first reason is that globally there are 24% prevalence of this fatty liver disease all over the world. That means that potentially 24% of the people could be impacted by this disease, the fatty liver disease. The other fact that I want to share with you is that those who live in the United States of America, like we live, the leading indication for the liver transplant today in the United States of America is fatty liver disease. In other words, the most common reason for the liver transplant in the US is fatty liver disease today. And also the most leading cause of liver cancer based on that is also the fatty liver disease, which as a result could complicate to the cirrhosis liver disease. So what is this disease? And so in briefly, I will talk about it. So non-alcohol fatty liver disease is basically a disease that is the fat depositions in the liver. Like you have scattered fats in the liver. Now, if you have less than 5% fats in the liver, generally that could be a normal pattern of the liver. But anything more than 5% fat that is scattered in the liver, it's considered non-alcohol fatty liver disease. Now, it's a spectrum of disease, so it could progress to different stages. So if you have a fatty liver disease, we will talk about it, how you diagnose it and how you do the other thing. So but if you have a fatty liver disease, what that implies is that you have more than 5% fats that is deposited in your liver cells. Now, if that is the first stage, which is reversible, pretty reversible, the next stage is called NASH, non-alcohol steatohepatitis. Now, what is the non-alcohol or the next stage of the fatty liver disease, which is called NASH? So NASH is the different or compared to the first stage of the liver disease is that in this stage, you still have more than 5% fat scattered all over the hepatocyte and the liver cells. But on the top of that, your liver started getting damaged slowly and develop inflammation. So in the NASH or in the second stage of the liver disease, now you have the inflammation, and it also could present with some scarring tissue also, with scarring tissue or without scarring tissue. So that's the second stage. Now, the risk of progression from this second stage up to the cirrhosis liver disease is about 20 to 30%, which is the third stage of this fatty liver disease. So the third stage is cirrhosis. The first stage was NAFLD, which is only 5% benign fats. It can progress to the NASH, which is the second stage that is presented with the fats plus inflammation plus scar tissue. And then the third stage is, like we mentioned, cirrhosis liver disease. What is cirrhosis liver disease? It's basically the scarring of the liver and permanent damage. That's the third stage. And the progression from the first and from the second stage to cirrhosis liver disease is about 20 to 30% over a period of a few years, right? So now okay, we talked about that, what the fatty liver disease is, what are these three different stages, and now who is at risk? What are some of the risk factors, or why it happens, or who gets it? So, uh, it's all about, folks, it's all about lifestyle, lifestyle, lifestyle. So, the fatty liver disease is very well correlated with the obesity. So I don't want to include the studies in this topic because due to the time constraints. So the most common risk factor is obesity, and to the patients who presented for the bariatric surgeries, with the weight loss surgery, 95% of those people, they had fatty liver disease. So, and a variety of studies, basically, they're very well correlated and they'll parallel with the obesity. So the more obese, the more parallel you can develop the fatty liver disease. The second common cause for the fatty liver disease is diabetes mellitus type 2 diabetes. 30 to 60% of the people with the diabetes, they have the fatty liver disease. That's the other. The next risk factor is dyslipidemia or high cholesterol or hyperlipidemia. That's the other risk factor. The next risk factor is insulin resistance. So insulin resistance is basically, the most common reason for the insulin resistance is if you have obesity or you have diabetes mellitus type 2, you do have insulin resistance, which is a separate topic. We can talk about it and you can discuss with your doctor. Hey, doc, do I have insulin resistance? And they will explain to you. Now, ethnicity. Some ethnic groups can have a high incidence of fatty liver disease compared to the other. For example, in our United States of America, Hispanic communities have a high incidence of fatty liver disease. Now, what is the pathophysiology of this disease? Okay, those were the risk factors, but what is the pathophysiology? Who gets it? So there were so many theories over the years. There was one theory which was called the two-hit hypothesis. Then we came to the other hypothesis called the multi-hit hypothesis. So the two-hit hypothesis were simple. It said, hey, you become, when you develop obesity, and you get a lot of fatty tissue in your liver, and as a result you develop inflammation, you get the fatty liver disease. That is two-hit hypothesis. Now we have the multi-hit hypothesis, which says that there are so many other factors implicated in the fatty liver disease. It's not just the inflammation. It has something to do with the gut flora. It also has the epigenetics, multifactorial, and the studies are still going on, right? So how we diagnose this fatty liver disease, and who should go and get it checked out. So the first, really in our hospital settings, and in our patients, usually we do just a routine blood work, and we see that the liver's enzymes are high, like ALT and AST. Those are some of the two common liver enzymes that we do. And then if I don't have any other reason to believe, like hepatitis or, metabolic diseases, medications, then I had to investigate the risk factor for those patients, and to further investigate that why the liver enzymes are high. So the liver enzymes could be one factor that are high, somebody with a fatty liver disease. The other thing is that imaging studies. We do the imaging studies such as CT scan or ultrasound of the liver, and suddenly, we will get the report, that the patient have a fatty liver disease, as incidental finding. So that's how we usually could diagnose it. Now, one of the thing, that usually we do the screening test for a lot of diseases. And in this case, so far there is no screening test available, and which is to say we don't just randomly check everybody's liver enzymes and everybody's imaging studies to see if we can find the this liver disease. But if you do have a risk factors, then it will make sense, right? What is the prevention and what is the treatment? I don't want to go into too much details due to the time constraints, and I want to keep this video as short and as productive. So first of all, a lot of people are claiming so many different things, but there is no FDA approved medication for the fatty liver disease. There is no medication so far, right? We talked about it that this fatty liver disease goes very parallel with the obesity increase. If your obesity increases, your fatty liver disease risk increases. The American Association for the Study of Liver Diseases, they do not recommend any screening test, which I don't agree with. The European Association for Study of Liver Diseases, they do recommend that the people with high risk, they should be screened, right? So what is, so we talked about there is no FDA approved medication, and so the first thing would be prevention, right? Which we talked about it, weight loss, lifestyle. Weight loss through lifestyle is not only good for the prevention of this disease, but also in the studies, which I don't want to involve all these studies, but if the people who lose 7 to 10% weight, 7 to 10% weight, usually they regress the second stage of this liver disease back to normal. Almost if you lose 7 to 10% weight, right? That was the studies. Some of the weight loss medications that they have been studied, like liraglutide, semaglutides, those groups, which the Ozempic, Saxenda, Wegovy, and those medications, when they were studied in the long term, they did regress the fatty liver disease. But again, was that because of those medication? Indirectly, yes, because you did lose a lot of weight with those medication, and as a result, you definitely had the regression in the fatty liver disease. Statins therapy for low cholesterol lowering, metformin for diabetes, which increases the insulin sensitivity, are also being studied, that decreases the incidence of fatty liver disease and also regresses in some cases. Bariatric surgery, interestingly enough, people who got the bariatric surgery, such as sleeve gastrectomy, Roux-en-Y, gastric bypass surgery, gastric balloon, 85% of those people, their fatty liver disease got regressed almost close to normal, right? So what is the conclusions? I don't want to go too much into details, but the conclusion is basically that I was saying initially that the NAFLD, or the non-alcoholic fatty liver disease, is the pandemic of this 21st century. And one should very carefully isolate the isolated steatosis versus NASH, the first stage versus the second stage. Once we are diagnosed with this disease, then it's important to do the staging, right? And the gold standard for the staging and for the diagnosis is basically the liver biopsy. And then again, that's for your doctor to decide on that. Also, so you wanted to know what stage of the liver disease you are on. Now, the early you do the intervention, the early you do the diet and lifestyle modification, you do the weight loss protocols, and you do your best with diet and lifestyle activities, the less chance for you to have this fatty liver disease. But if you do have it, the only and the best way to to regress this disease, if you catch it in the early stages, because once you develop the third stage, that is the cirrhosis liver disease with the scarring of the liver, it becomes a little complicated and very risky and almost impossible to regress the disease back to normal. Sustained weight loss is the key and in the answer to that. So what I will say is that, just a few more words, is that if you think that you're at risk, which is if you are diabetic, if you have obesity, if you are overweight, if you are in certain ethnic groups, right? If you are on certain medications, and you are routine checkup. So you wanted to make sure that you include these liver enzymes in your test. And if they are slightly elevated, then you need to have a conversation with your doctor to go for the studies. Do you want to do the imaging study? There is a test called FibroScan that is non-invasive that will tell you if you have a scarring or if you have a which stage of the disease is there. And then if you catch it in the early stage, there's something you can do about it. And if you see your loved ones, your friends, your colleagues, if you think that they will, benefit from information like that, and they might have the risk factors, please pass the information on, to see if they will benefit from them. Hope that information briefly will help, to keep us healthy and strong. And have a wonderful day. Thank you.